Welcome back. As states all across the country gear up for the possibility of COVID surges after Labor Day, health officials are trying to find some new ways to battle pandemic misinformation, with millions of Americans still not vaccinated. So in California, here's what they're doing. San Diego County declared COVID misinformation a public health crisis this past week, a move that prompted praise from the U.S. Surgeon General. Joining me now is San Diego County Supervisor Nathan Fletcher, who authored this resolution. Nathan, good morning. Good afternoon. Forgive me, and thank you for being on the show.
Thank you, Hallie. Thank you for having me on.
And I suppose it's morning where you are, so I can get away with that. Let me ask you,
morning, afternoon.
There you go. Couple of key questions for you here. I want to get to what you specifically and concretely hope to see from this declaration, but I have to get to the backlash of it, because the county meeting at which this happened lasted 15 hours the day the resolution passed. That is a very long time for a county meeting. Let me play a little bit for our viewers to see what it was like that day. Watch.
Last I checked, you aren't my health care provider. The Constitution and the right to privacy guarantee us this. That's why this is America, and you guys can't make your camps for the unvaccinated.
All you do is spread misinformation, then you want to call us terrorists and say we're a freaking public health threat.
You're not working for the people, so you must be working against us for some foreign interest.
Basically, this is Chinese censorship, propaganda, forced vaccination. You guys should just call it what it is.
How do you respond to those folks? I know that there are no penalties, right, in place with this, in part, so you can protect free speech. But what do you say to folks who are saying to you, you're a tool of China, you're the one who's spreading misinformation?
Well, Hallie, we sat there for 15 hours and we listened to so many people who demonstrated the need for us to take this action. We heard that. We heard folks say, I'm a doctor and I did my own research, and you're not a medical doctor, you're a chiropractor, and the research you're touting has been debunked many times over. But the reality is this anti-vax, anti-science segment that so often was relegated to the fringes of our society has grown. It's now a plank in today's Republican Party. And we will not defeat COVID-19 if we don't beat back misinformation. And it's not enough anymore, Hallie, to just promote the science. We've been doing that for 18 months. We have to aggressively and intentionally tackle the misinformation that is taking hold, and it's costing people their lives.
So how do you do that, right? Because with all due respect, you obviously don't run Facebook, right? Like, you can't get out there and take stuff down off social media. So how do you hope to do it, and what do you want to see out of it?
Well, the Surgeon General, look, this is a national problem, and I want to commend the Surgeon General. It was their report on misinformation that got us moving, and it was their recommendations that we put into our action here. But a national problem is going to require local action. And in San Diego, we've seen tremendous success. More than 75% of our eligible folks are fully vaccinated. And the way we got there was intentionally engaging with communities to address concerns. Now we have to shift that focus. The number one barrier to people getting vaccinated today, they know it's available, they know it's free, they have bought into this. And so we are engaging with healthcare experts. We're directly confronting, you may have heard this is why it's not true. So much of our success in using trusted messengers is being replicated here. We're going to add a component to our board meetings, where after 15 hours of misinformation, we will go to a panel of doctors that will point by point refute the things that were said that are factually inaccurate. And we're going to go out and do everything we can to save every life possible.
You talk about trusted messengers. I know that's so important when it comes to combating misinformation, because people who feel attacked shut down and turn away, right? Like, that is not the way to get people who are taking in this misinformation, not getting vaccinated, to change their minds. I wonder what percentage of the people in your county who currently right now, let's say, are not vaccinated, right, do you think are, to use a political word, quote unquote, persuadable? In other words, how many of those people, what percentage of those people do you think you can reach with this new effort on misinformation?
Well, I think in many ways, Hallie, the best messengers are going to be those that came out of tragedy. We saw a story this weekend in San Diego. Christina Lowe, her husband, 38-year-old firefighter, they didn't get the vaccine because they don't like the governor and they don't like the president. And he died. And he told his wife, you have to get vaccinated. And she said today, when you got two little kids without a father, none of it matters. And that's a tragedy we want to avoid. But it's going to be those voices, along with our doctors and community leaders, who are willing to step up and say, this isn't partisan, this isn't ideological, this is science, this is fact, save your own life.
Nathan Fletcher, we're so glad to have you on the show this afternoon to talk about it. Thank you for your time, and thanks to all of you for being with us this afternoon.